All right, our next topic is the community guidelines for shelter program expansion and the supportive housing services proposed work plan for the next fiscal year, which will be year 2. Wow, so that reminds me, it's really only been 1 year. I misspoke in our prior topic because we spent 1 year organizing all of it and now 1 year doing it. All righty, well, we'll turn it over to you, to our housing experts, Josh Kreitz, Jess Larson, and Ms. Janine Smith.
Well, good morning, Chair Harrington and Board. Josh Kreitz here, Assistant Director of the Housing Department. It's great to be with you. And yeah, it has been a fast and furious last 12 to 15 months starting to stand this program up. So we're excited to be here. Today's program update is not a quarterly report, but there are 2 important items that need to come to your board for awareness and continued direction. The first being the conclusion of the work that was directed to us in December, and that was the work of engaging the broad community discussions about our future shelter expansion work and creating guidelines to inform that work. Second, we also have the draft work plan for the next fiscal year. This is a newly required annual report due to Metro each spring. And again, this is a continuation of our local implementation plan, providing updated annual goals for the upcoming year. So we have a full report, so I'm not going to spend much time today. I'm going to turn over to Jess and the team who put together a really good report, and look forward to your questions and feedback at the end.
Thank you, Josh. Good morning, Board. Chair Harrington, it's a pleasure to be with you. My name, for the record, is Jess Larson, and I use she and her pronouns, and I'm your Supportive Housing Services Program Manager. And I'm joined here with our colleagues from the team, Alex Devon and Janine Smith. They'll both introduce themselves when they take on their part of the presentation. Next slide, please. So as Josh outlined for you, we have 2 different programmatic bodies of work that we're bringing forward for your awareness and attention and further direction and feedback today. The first is the community guidelines for our shelter program expansion work. And the second is that new work plan that's due every year. It's a continuation of the local implementation plan, as Josh described. And then at the end of the presentation, we will receive your questions and feedback on both items. Next slide. So getting started with our community guidelines for the shelter program expansion. As you will recall, you asked us as staff to conduct broad community feedback to engage our Washington County community, those impacted by homelessness, those providing services to address homelessness, and the surrounding community of neighbors and businesses concerned about homelessness. We wanted to seek their feedback and engagement and also provide some information about our growing shelter program work, now made possible with the Supportive Housing Services Program. As you will recall, also in our local implementation plan that we created as our framework for this 10-year program, we made a commitment to achieve 250 new year-round shelter beds. We anticipate this will require between 5 to 7 new sites that will host these shelter programs. And in order to begin that work, we went about this community discussion, if you will, to gather feedback, to provide information, and ultimately to co-create these community guidelines that will be a tool for staff in guiding our ongoing programmatic work in partnership with the community as we identify these 5 to 7 sites and then launch these future shelter programs. So that is the context of this first part of our presentation. And before I turn it over to Janine to walk you through the work and the ultimate guidelines, I want to express just really big gratitude on behalf of our department leadership for the work of both Janine Smith and Ty Schwefferman, and also Jesse Adams and Highland Edelman. They were just a tremendous team that led this big body of work, and Janine is here to represent it for them all. Okay, over to you, Janine.
Thank you, Jess. Salutations, everyone. Once again, for the record, I'm Janine Smith. I use she, her pronouns. I am in Supportive Housing Services and also the Office of Equity, Inclusion, and Community Engagement. So jumping right into it, I think we need to switch to the next slide, actually. Thank you. The Department of Housing Services and Office of Equity, Inclusion, and Community Engagement led a robust community engagement process to elicit feedback from Washington County residents, community stakeholders, and individuals experiencing homelessness. Now, for the purpose of this portion of the presentation, it should be noted that when I indicate individuals experiencing homelessness, that may be interchangeably used as impacted people or people impacted by homelessness. This is not to minimize or diminish the reality that community members and stakeholders too are impacted by homelessness or impacted by the homeless crisis. Staff recognized from previous shelter engagement experiences that we must provide upfront and sustained community engagement opportunities. The Department of Housing Services and Office of Equity, Inclusion, and Community Engagement wanted to ensure that we took a regional approach while gathering feedback to assist with the co-creation of community guidelines for shelter program expansion. In 2 weeks' time, staff utilized several tools such as community engagement events, surveys, polls, newsletters, emails, social media, word of mouth, all of the things to distribute information and collect data. When I tell you, staff made several attempts to reach individuals far and wide throughout Washington County. We exhausted every avenue that we could think of, and it worked. We did not just read the responses, we needed to hear the voices of the people who would be most impacted by shelter programs. The goal was to receive diversity and feedback, and in order to do this, we had to meet people where they were at. This includes the utilization of interpretation services and translated documentation as well. Staff conducted in-person interviews at shelters to reach participants who otherwise may not have had access to other forms of communication. Staff also utilized city and community-based partners to collaboratively support these efforts as well. Next slide, please. The Department of Housing Services and Office of Equity, Inclusion, and Community Engagement had the capacity to host 4 regional community engagement events, which included Forest Grove, Cornelius, and surrounding areas, Tigard, Tualatin, Beaverton, and surrounding areas, Aloha, Hillsborough, and surrounding areas, and lastly, a countywide event for those who did not or could not attend the other 3 events. Out of the 180 registered participants, we hosted a total of 95 individuals to include, but not limited to, news outlets, city partners, community members and advocates, stakeholders, and individuals experiencing homelessness. During these community events, participants were able to engage in poll questions, breakout room sessions, and surveys in order to ask questions in real time. The consensus from all 4 events were largely in support of the efforts that are being made to ensure transparent communication. Next slide, please. So let's discuss the surveys. As a huge part and one of the most informative tools used to collect data, staff created and utilized 3 different surveys to elicit feedback. The community member survey received 175 responses, which exceeded its goal. The stakeholder survey received 30 responses, which exceeded its goal. And the impacted people survey, which was geared towards shelter participants and other individuals experiencing homelessness, received 38 responses, which exceeded its goal. Staff conducted in-person interviews at the Cloverleaf and Beaverton shelters to complete the impacted people surveys. We also used interpreters while out interviewing people as well. Next slide, please. Thank you. After gathering all of this robust information, the question is, what does staff do with all of this compiled data? Great question. The data was compiled and placed into feedback themes to include addressing the unmet needs in our community. So you've heard about the need to expand up to 250 shelter beds. Staff also heard the need for capital funding to support shelters as resources for the acquisition, rehabilitation, construction, and site preparation as they are limited. We also heard that people need access to support. The shelter system needs and would benefit from a comprehensive coordinated system of care. Shelters should be safe. Safety is always a huge concern. Community safety should be addressed through 24/7 person-centered security services. Shelter participants largely feel safer in Washington County programs than being unsheltered, is one of the highlights that we heard while interviewing. Diversity of shelter system options. So creating a diverse and equitable sheltering system with various shelter models and locations can meet the growing need within Washington County. The community should be involved. Community members indicated that it should be important to keep the community informed when future shelter programs are located. It should be noted that many shelter participants expressed how appreciative they were of shelter programs in Washington County. They were so excited, and that was like the highlight of the engagement series for myself. Next slide, please. So now here is the meat and potatoes, the guideline recommendations. The feedback outlined was used to create the following best practices for locating and operating shelters throughout the county. These guidelines will be utilized as county staff and consultants, led property searches, design shelters, and implement programs. Although the community will not be asked every time, a potential location is identified, staff will utilize the co-created guidelines as a tool. These guidelines are very important and is as follows. So access to frequent and reliable transportation. Shelter programs should be located near readily available transportation services to ensure people can successfully access and exit shelter programs. Accessible public transportation is critical to people experiencing homelessness as it assists with applying and maintaining employment, access to education, mental health services, medical services, and meet other needs. Next is access to services, employment, and community resources. Equitable shelter locations would come with low barriers to access services. Access to services assists clients with connection to the community and creates a platform for transitioning back into housing stability. Access to community resources such as food banks, mental health and medical care, outreach organizations, childcare assistance, alcohol and drug recovery support, and supportive services assist clients with maintaining stability as they transition. Access to culturally specific services will also be valued as they help to provide culturally competent support to communities of color, refugees, and immigrants. This is one of the items that a lot of people express that they are interested in during our events. Geographic and demographic distribution. Shelter programs will not be concentrated in low income or neighborhoods where a high percentage of communities of color reside to prevent undue burden. Consideration of potential economic or social stress on neighboring businesses and residents will be made, especially in low-income communities. Geographic and demographic distribution will also include a diverse and equitable sharing system with various shelter models, such as alternative shelters and congregate shelters and non-congregate shelter models to create more housing options. Attention to local community impacts. Some locations may not be suitable for shelter programs due to the proximity of other sensitive public areas, such as schools, playgrounds, early learning programs, and public parks. All shelter programs will be designed to partner with the surrounding community and mitigate any changes, and any proximity to sensitive public areas will be examined carefully before proceeding. It should also be acknowledged that sometimes proximity to places like public parks and playgrounds and schools can also be a benefit to a neighborhood as well, or to a shelter program as well. Strong program management. An experienced service provider with abundant staffing, training, and management support is critical to the success of a program, ensuring equitable outcomes for program participants in a surrounding community. Therefore, shelter staff will reflect the diverse populations impacted by homelessness. Ensuring equitable community and participant safety. Once again, proactive, culturally and linguistically appropriate and person-centered security services will be considered to prevent over-policing of program participants and help mitigate community member concerns. Person-centered security service should have knowledge of different cultural norms, responses, and impacts of over-policing in communities of color, as well as refugee and immigrant populations experiencing homelessness. Support community livability. Shelter programs will assist with safe storage of personal belongings, monitoring spillover such as garbage, hazardous materials, and sharps from shelter participants, in addition to community members utilizing shelter grounds as a dump site for garbage or unwanted things. So cleanliness is definitely something that we also want to focus on. Transparent and accountable communication. As previously mentioned, community concerns about shelter programs and unsheltered homelessness will be addressed through frequent, open, and transparent communication, which I believe we've demonstrated with the public and the community local to a shelter program. Identifying neighborhood demographics. This is also important. We utilize mapping tools to help identify needs of a community by understanding considerations such as languages spoken within a home, special religious practices, and household income status. And lastly, co-creating community agreements, which this is an example of. A community agreement process will uplift community concerns and identify solutions that can be agreed to by all parties, including neighbors, program operators, and building owners. Community leaders and program participants will work together to liaise concerns and communications and foster a trust and relationship between all parties with each shelter program. I know that was a mouthful, so I will turn it over, and thank you.
Thank you, Janine. Thank you so much. Next slide, please. So as Janine said, that was a lot of work. This can all be found, curated very thoughtfully and clearly in a kind of partner public-facing document called our Community Guidelines. It was shared with you in these board materials, and we are currently working on finalizing this draft. It will be a living document, though, as we continue to receive feedback and learn from the processes of helping to locate, engage our community in the surrounding neighborhoods and launch new shelter programs. So today we hope to receive any feedback from you as we finalize this document, and then the next steps from there would be immediately, we've already begun working with our partners in the city of Beaverton and city of Hillsborough and in Tigard, where there are potential sites that have been identified, and engagement work that would begin immediately with the specific surrounding community to start discussing those future programs. And we will also be looking for additional sites. We're challenged with a limitation of shelter services right now because of a lack of sites where we can offer winter shelter programming. And of course, our goal is to get to year-round shelter programming, but I must be frank and say it'll be challenging even next year to have as much winter shelter capacity as we did this year with the limitations we have around locations and sites. So we will be actively working on citing those sites as well in the near future. And of course, any potential site that meets the criteria that is described in these guidelines will be brought forth for further discussion with that local community before any programming is begun. So that is how we plan to use this tool. And those are the immediate next steps for beginning the work of shelter program expansion in accordance with this emerging tool. And as I said, we're going to take further feedback and questions from you at the end of the presentation. So if it's all right, I would like to transition us now into part 2, which is again about that annual work plan. Next slide, please. So kind of a hard pivot here, but the annual work plan, as we have described, builds upon our local implementation plan that set forth the 10-year framework for this 10-year program. And in that local implementation plan, we set forth goals for the first year of programming. So now this annual work plan, which is described in the intergovernmental agreement, which has since been negotiated and executed with Metro and our county partners, in that IGA, it describes a new report that will be due every spring called a work plan, which sets forth the goals for the upcoming program year. And this will be the tool for which we kind of track our progress over the program implementation in the coming year, and then ultimately measure our outcomes against in our annual reports for the subsequent October following a program year. So that is the sort of orientation of the purpose of this work plan. Next slide. And as a reminder, before we get started in thinking about next year, let's think about this current year. You've seen these many, many times. They were a part of our local implementation plan, and it is how we've been tracking our work so far this year. So we set ambitious and yet we hoped achievable goals for our first year of the program, a goal to achieve 500 supportive housing placements in the first year, and a goal to support an additional 500 households with other kinds of housing stability, and then a goal to create 100 year-round shelter beds added to our current capacity. We also wanted to ensure that we were expanding culturally specific capacity in our services by investing in a culturally specific network, and ensure that our outcomes were demonstrating how we were advancing racial equity through who was being served in our programs. So those were the goals set forth in year one, and I'm going to pivot it over to Alex next to give you a brief update of where we're at so far and what we've learned from our first year of programming and what we're taking into making this decision for our next year, our proposed work plan goals for year two. We do need to note that the information we have so far is only up until the end of quarter two, which was the end of the calendar year, December 31st. We will be having quarter three updates for you and data to review in the coming weeks. We just don't have that at hand. So some of the data you're going to see is a bit dated data, but it was an important kind of, it was what we had to help make these decisions. So yes, with that, I will pass the baton over to Alex to give us a programmatic update and walk you through how we're making this recommendation for our year two work plan goals.
Thank you, Jess. Hi, everybody. My name is Alex Devon. I am the Services Network Administrator for the Supportive Housing Services. What that essentially means is programming technical assistance for the providers to be successful and do their jobs and have good contracts. Next slide, please. So we'll, like Janine said, get into the meat and potatoes of this. As you see, these numbers are a little dated. They are from December 31st. But our first year was essentially a year of growth, right? We brought in 18 contractors that the vast majority of them had not had any government contracts of any sort before this. So we rewrote a very simple and easy contracting structure and launched contracts with our providers in August of this year. What we learned from this experience essentially is that it takes a long time for our community-based partners to get the traction needed to grow and hire new staff and build their own infrastructure. And we're still seeing a lot of our organizations currently bringing on and onboarding new case managers even up to today. So even though those contracts did go out in August, it did take some time for everybody to get moving. What we see is the 94 placements for population B. That was from December. So I believe this morning I saw a visualization from a data meeting, and we're at 147. It also looks like we have about 357 households that are holding an ARLA voucher in their hands and are currently looking for units. So we do project that we'll be able to hit about 350 to 400 placements by the end of this fiscal year, or June 30th. What we discussed this morning was that we have gotten 3 times more requests for inspections and unit inspections in the last month than we have ever seen in the housing department ever. So, we are tripling the move-ins that we normally see. So traction has hit and it's moving pretty fast. Under population B, you will see that there was originally a goal for 500. We learned this year that there's only so much growth that our providers can do at any given time, and launching almost 800 units amongst 18 providers, as well as the most robust winter shelter season we've ever seen in Washington County, showed us that not only us at the Supportive Housing Services team, but also our provider network only have so much capacity. So that population B number will be, slid over to year 2. And that'll be a part of our goals for next year. I also would say we're really proud of the training curriculum. We've trained over 100 new or existing case managers. We did multiple four-day housing navigation boot camps. We've done trauma-informed training, behavioral health one-on-one training, assessing soft skills training. I mean, the list goes on and on. There's a training that occurs at least once a week, and that has been consistently happening since the fall. And so we're also, I'll tease more about some of the future growth with some of the trainings at later slides. But what we have learned is that this is really complex work. There's a lot of technical assistance that is involved. There's a lot of work we need to do with our providers, a lot of feedbacks to get them to be successful, but the end result is really starting to show itself right now. And then the last, you'll see the year-round shelter capacity. We projected 100 beds. We hit 102 this year, so we exceeded the expectations for year 1 with shelter expansion. Next slide, please. All right, so this is the fun stuff. What are we going to be rolling out next fiscal year? And this is something we've all been working really hard on to make sure that the providers are going to have their contracts before June 30th, so they have extra time to build out their capacity and hire. But one program that was already just started its soft launch is housing liaisons embedded in HHS programs. So I can say one example is a housing case manager that will be at the Hawthorne Walk-In Center. And so we're doing 5 pilots at different locations that Health and Human Services have front doors where they see a high level of inflow of persons that are experiencing a housing crisis. And we're embedding housing specialists at the locations so that they can work with those folks and get them connected. Another thing that we're designing right now and will be launched next fiscal year is a lived experience workforce training pilot. Essentially, in a nutshell, we are going to give people that have been housed or have lived experience with homelessness the opportunity to become case managers, if that is something that they feel in their heart to do. We will do that by a comprehensive training curriculum, also a paid internship where they will work at a provider agency for 6 months and be compensated for their time. And after those 6 months, get the opportunity to, get onboarded and higher up, quite possibly with the organization that they're interning with. So we're looking to do 4 cohorts a year on an ongoing cycle, and this will hopefully build up the staffing infrastructure that we also need with the huge expansion of these rehousing programs in Washington County. We will be launching population B focused housing programs. Rapid rehousing, we're calling ours enhanced rapid rehousing. Why are we calling it enhanced? It's because it's better than the way the federal government does it, and it's better than the way that the state does it. We've lowered the screening criteria, we removed the barriers, we got rid of all the gobbledygook and made a very, very simple program where people can get financial assistance and wraparound services for anywhere from 3 months to 2 years. So this is really, folks that are newly experiencing homelessness, they were in a financial crisis, they have the ability to work, be educated, and maybe find a new career, and then after 2 years be set free to live their lives, right? And then we'll also be launching a thing called Rapid Resolution. This is a program that was originally launched through the Veterans Administration, through their supportive services for veterans' families, and now is considered a national best practice. And all it really is the ability to access one-time financial assistance if a household just needs one thing. Like, is one thing in their lives that is preventing them from either moving into a house or sustaining their current house, right? It could be the car broke down and they can't go to work and they missed their rent. And if they had the car fixed, they could go to work and then they wouldn't have this problem. Well, then let's just fix the car. It could be a household that found a unit and they just don't have the security deposit because security deposits are 2 times the rent. And most people don't have that in the bank especially when they're out on the streets or in a housing crisis. Well, let's just pay the security deposit and move on. So it'll be a very robust list of about 44 different items that case managers anywhere in the system, whether they're funded through us or not, can access for their participant to resolve their crisis. We will also be expanding the current outreach infrastructure. To give like a kind of like a ballpark side note, like the initial funding for outreach in Washington County was about $250,000 of federal funds. It was expanded pretty significantly through ESG COVID relief funds, and that was one-time funds, and those funds will be sunsetting at the end of this fiscal year. And so we're going to take on that additional outreach infrastructure that was built due to COVID, and then we're going to expand it even more. And the goal is to have 16 outreach workers throughout Washington County, helping people that are in encampments or in a housing crisis, don't have the ability to really walk through a front door to get those services. So that is something else we'll be launching early next fiscal year, actually July. We'll also be looking at some access centers and bringing more front doors to the system across Washington County. The hope is to bring at least 8 new front doors and equitably located throughout the county, as well as some continued shelter expansion, which Janine did such a wonderful job talking about before me. We'll also be expanding our permanent supportive housing programs, such as the Aloha Inn, right? We're going to keep working on building out these PSH, these units for people that need to live in a setting where they have wraparound supports right outside their front door, because they just won't be as successful if there are scattered site locations, right? So we want to keep building out that capacity for permanent supportive housing programs. All right. Oh, and I didn't even talk about, we're also launching a training academy. So, you know, we noticed a gap. The gap was people need training. Everybody needs training. There's so many trainings. So what are we going to do? We're actually going to launch an online training academy, as well as a library, a resource library. And so this will actually solidify our training programs throughout Washington County, so that we know that every case manager is getting all of the trainings they need, all the updates they need to be doing the best darn job they can be doing and helping our neighbors get inside. Next slide, please. So SHS revenue growth projected. So year 1 projected was 38 million. Year 2 is 50 million. That goes really, really quick once you start putting the numbers together. And it looks like we have just enough to reach the goals that we're projecting here. If you'll see though, that like the vast majority of our funding for the homeless response system in Washington County is through the supportive housing services. About $15 million of that funding is federal. So we would say the actual total revenue for homeless fund programs is about 65 million. The beauty of that though is that a lot of federal programs have a lot of barriers. They make it a little more challenging for everybody. They have a lot of paperwork. It's very arduous. And so we're able to create programs and launch programs that basically eliminate all of the barriers that you would see in a federally funded program, which makes it really much more easier for the case managers and a much more trauma-informed experience for people that are currently experiencing a housing crisis. But this money will also be needed for the long-term support necessary for the 1,665 people that we will have in housing, who will continue to need case management services and their vouchers or their subsidies paid for, as well as the 250 program beds across Washington County. So that's about $50 million to support all of that, probably on an annual basis. Next slide, please. So goals for year 2, as you'll see, we're going to double down on population A, or our harder to serve folks, the ones that have more needs essentially, and we're gonna do 500 more next year. We're going to launch the rapid rehousing programs with our provider network, and that'll be another 400 placements, and then we'll do 200 placements of the one-time assistance. We might need to modify or adjust that mid-year to see how we're doing. If we're using a lot of rapid resolution and it's really successful, we might have to adjust that number. We don't know quite yet. We want to see, you know, keep our pulse on how things are going and make adjustments and pivot as needed. Also the outreach workers. So we will be expanding the number of boots on the ground, right? So this year we brought in 38 new boots on the ground. Next year, we're hoping to bring in 72 more boots on the ground, which will give us around 110, case managers all out there working. And they'll all be working with participants at a 20-to-1 case management ratio. So it won't be a bogged down system where people can't even find their case manager. These case managers have these horrible caseloads and they can't do their jobs. We're giving case managers a very, very fair and easier to navigate caseloads so that we ensure their success, right? We'll also be projected to expand PSH capacity by 100 units in Washington County, as well as our year-round shelter capacity. We want to hit 177 permanent year-round shelter beds and or units by the end of year 2. And I believe that is the programmatic update. I will send it back over to Jess.
Thank you, Alex. It's a tremendous amount of work, as you can all see and hear. In addition to those outcome and capacity goals, right? The outcomes are housing placements, people we are placing in housing. The capacity goals are the system's capacity to respond, the outreach workers, the shelter beds, etc. So in addition to those work plan goals for next year, we also have equity-focused goals in our work plan for next year. We aim to add three additional culturally specific service providers to our network of service providers. We have 4 so far on board. We want to bring 3 more on board to expand our capacity to provide culturally specific services. Alex talked a lot about the training. We're going to make sure that that training program, that training institute, includes strong equity programs to trainings for all of our providers, whether they work for culturally specific or not culturally specific organizations, ensuring geographic equity in our programs so that there's access and shelter all throughout the urbanized Washington County to for folks seeking our services. And last, we continue to set forth a goal and a commitment that our housing outcomes demonstrate that we're advancing racial equity. And what that means is that we're serving at a higher rate people of color in our programs to mitigate the disparate the history of inaccess to housing programs, and not only serving households of color at a higher rate, but also ensuring as good or better outcomes in our programs for households of color. So that's how we demonstrate racial equity being advanced through our programming. So that is the content of our work plan, draft proposed work plan. And so the last slide now leads us into our questions or an opportunity to hear your questions and receive feedback and further direction from you. So first we have the community guidelines. Do you have any further questions or feedback for us as we finalize that draft? And the second question being, does the board support this draft and staff moving forward with the program expansion as we've described? And then the second set of questions are regarding the annual work plan. Do you have any questions or feedback for us as we've developed those goals for next year? And do you support our submission of this report to Metro as it is required for the program? So that is the conclusion of our presentation. The staff stands by to receive your questions and feedback. Thank you.
Great information, staff, and thank you for laying this out so well, in addition to including all the documents in the packet. So commissioners, with the 4 of you, what questions do you have about all of this rich information? What comments do you have? And how do you have input to help ensure that we as a body of 5 provide direction, cohesive direction to our staff? Who would like to go first, or in whatever order? Go ahead, Commissioner Fye. Thank you for using your hand raised feature.
Thank you. This was a really great presentation, and I really appreciate the staff, all the work that they put in. I have they all seem like our efforts of Washington County seem more focused on buildings and motels. And I'd like to ask a clarifying question around around safe parking. The folks that Brenda and myself visited in Salem said that folks who are in RVs feel like they are, that's their permanent home. So how are we meeting those people, folks who are using RV, where they're at, and what should we be doing around safe parking. And then I read the text. I think there's a part where alternative shelters were mentioned in the document. And essentially, what we're saying is alternative shelters are considered, but we're pushing more towards Congregate. And I don't think that's really a good route for Washington County. And I'm not sure if that's what we're trying to depict to our community, that even though folks are expressing curiosity and interest, we're not listening to them. And I'll stop right there to let the staff respond.
Well, thanks, Commissioner Fry. I'll take a first pass at your questions. I think what we've heard out in the community and as staff, what we continue to center is that there is a full range needed to serve our population, right? And alternative shelters, safe parking programs, that again is a part of that solution. But as we look at those solutions, we have to engage with our community, we have to engage with our jurisdictional partners and see what is feasible. So one thing that we've really learned is the same amount of effort that would go into citing a, let's say, congregate shelter or a non-congregate shelter, the community engagement, community pushback, discussions about impact communities, the same thing takes place when we have these conversations about safe RV program or alternative sheltering program. So again, we do absolutely see it within the range, but these are just ongoing conversations that we're having broadly with all of our community partners and all of our jurisdictional partners about what's possible. And I'll state pretty clearly, we also need our jurisdictional partners and our community partners to help work with us. Washington County can't instigate every single new shelter opportunity. So I think Jess showed a picture of like the Hillsborough shelter, and that's great because that's the city taking an active role in something that they see as a priority. And that's something that we're able to partner, support, and just move forward on. So that's kind of my first pass at that. I'll ask Jess if there's anything she wants to add to that statement.
Thank you, Josh. I think that you correctly reflected that. We do not intend to show any preference one way or the other. In fact, the preference is we need a menu of sheltering types, sheltering program options. So safe parking and alternative kind of camping is very much a part of that menu of options that we need to stand up within our 250 bed goal. And speaking to that shelter program that Hillsborough is working towards, there is consideration for some alternative style shelter programming on site in addition to the kind of the official building that they've purchased. So we just really want to affirm that both are very much a part of our programmatic priorities.
Thank you, Josh and Jess, for that response. I guess then, listening to what you just said, I did not get that point across from these documents that you presented and the presentation you provided, that you're exploring all kinds of options and looking into a list of menus. So I guess my feedback to the first question is like, maybe make that explicit for our community that we're not gearing towards buildings and motels, that we're exploring all kinds of options here, and pod villages, RVs, safe parking, it's part of that, because I like to just say it might just be me, but I didn't get that point across. And I did get the point that, that we overlooked the interest and the curiosity of the people. And that was just me just reading as a commissioner here. So I would like us to maybe go back to the community guidelines for this shelter program expansion and make that explicit for our community, that we're not geared towards sort of congruent that we're looking for all the options, and we're looking all kinds of partnerships, and then I like to put myself, say I'm available to see what I can do as a commissioner to help with our partners to bring them to the table. If you are experiencing pushback or anybody not being open to these options of exploring what's available, I like to offer myself to say, let me know who I should be talking to. But that's my first take on this draft document that you're
Thank you for that feedback. And I would say, that we are seeing really good partnership from our jurisdictions. There's a lot of great communications happening around all different types of shelter options right now. And I know Jess is leading, I think, sometimes weekly meetings about this. So thank you for that feedback.
Commissioner Fye, did you have any other comments or questions on the remaining questions? So the first two are with regard to the guidelines, and then the second two are on the proposed annual work plan. Your thumbs up? Okay.
Yeah. Thank you, Chair Harrington. Sorry about that. The work plan, you all are doing great, and I appreciate all the kindness and compassion you're providing into this work. And I guess the plan year 2 for the future work plan, I don't think the community guideline changing that would have anything to do, correct? Just want to clarify.
That's correct, Commissioner. We can update the community guidelines document with the feedback you've given us, and that does not need to change the work plan document. Yeah,
so Chair Harrington, you're correct. You have my thumbs up for that then. Good work.
Okay, great. So for you other 3 district commissioners, what are your questions, comments? Go ahead, Commissioner Treese.
I just wanted to get my hand raised electronically. So I just want to say thank you for this body of work. And I'd like to call out the equity lens that you've used here and just say I greatly appreciate that work. It's clear that it has been a guide all the way along, and I just want to underscore my appreciation. So thank you. And I'm thumbs up.
Go ahead, Vice Chair Willie.
Yes, I officially raised my hand as well. I don't do that very often. Well, this is a lot of information. You did it very well. You have it laid out very well. It is. I'm guessing that's it didn't have page numbers on. I'm guessing that's a 30-page document or something. But so here's a couple of questions. I think it concerns me a little bit, honestly, on slide 15 that your proposed outcome and capacity goals are pretty significant, considering that your supportive housing placements in the first 6 months, as the other slide showed, we're at about 20%. Some of the other statistics were pretty low as well. And I know that you communicated that it looks like we're going to hit our targets by June 30th. So that would be good. But then you've doubled it again for the year 2. I'm not questioning what your proposal is. I'm just saying that it looks like it's pretty aggressive. What happens if we don't meet those criteria? Does the IGA reflect something? I mean, is there some sort of I won't call it punishment, but is there a downside if we don't meet those criteria?
Thank you, Commissioner. I actually really appreciate you bringing this to clear attention. To ultimately answer your question, no, we are. The work plan is a required report, but it is one that we can adjust as we go over the course of the year if we have updated information that suddenly changes our assessment of what can be achieved in the course of the year. So this is our assessment based on all the information we've learned over the course of last year. And you are correct. We are still setting forth quite ambitious goals for year 2. Though with all the information we've gathered over the course of the year, we think they're even more achievable this year. So what you saw in the data that Alex was reviewing is really the reflection of about 6 months of time when no housing was happening, because all of the preparation, the hiring, the system building, the training was happening. And in year 2, we will be starting with that work already underway or already sort of building upon that systems work that we spent the first 6 months doing. So knowing that we're going to get to about 350, maybe 400 housing placements in year 1 makes us hopeful that we can and should continue to set ambitious goals, because we can achieve those goals in year 2. And we think we'll actually catch up and fill the placements that weren't filled in year 1. With the second goal, we decided to just not even launch that program. It wasn't ready. Our partners weren't ready. So now they are ready. And so again, yes, I want to concur with your assessment that we are setting ambitious goals, though we think the information supports that. And also, if we learn more along the way, there won't be any penalty or conflict, or we won't be breaking our IGA if we have to adjust those goals based on that information.
And maybe I can just piggyback off on that really quickly. I think in my experience standing up housing programs over the last 15 years or so, what I'm seeing on the back end, which most of you don't see obviously, is just a increase in the pipeline of folks coming through. And I mean that in all the right ways. We have just seen a massive expansion of the amount of folks who are getting into the system, who are getting subsidies in their hands, and who are out there looking right now, hundreds of people who are looking right now. And so in my estimation, in my experience, I feel very, very confident that this program is going to expand rapidly. We're going to start hitting some really big numbers in the next 6 to 12 months.
Well, and I think the reason, one of the reasons why I was thinking that, and I could be remembering this totally wrong, so feel free to tell me I'm wrong. It seemed that our allocation, between the 3 counties, was set for 3 years and then subject to reevaluation. And I can't remember what that reevaluation part of it is, but I just want to make sure that our work plan kind of is consistent to make sure that we're kind of meeting the expectations of the oversight committee or whoever would make up the mind on how this is going to be reallocated in year 4 and beyond. So am I totally not remembering this correctly? And does our work plan, is it consistent with where we want to be in year 4, 5, and 6 to make sure we continue to get our appropriate allocation of the overall pot of money?
Thank you, Commissioner. It's an important question to be planning ahead. I appreciate that. It's a slight adjustment on what you're describing. It's not a reallocation of funding. It's the reconsideration of the allocation formula. So right now, our percentage is based on an assumption that Washington County generates about 33.33% of these taxes that are being collected. And at the end of year 2, our IGA states that we, as 3 counties and Metro, could come back and reconsider that formula that results in our 33.33% and adjust that to be more reflective of actual collection.
Okay.
So right now, the revenue projections we are sharing with you are based on that 33.33%. It is possible that that formula will change, and we would adjust all of our programming work according to any changes made in that formula when the jurisdictions cross that bridge.
Okay, thank you. Just two more quick questions. Actually, one observation, one question. I can't find the slide where you said how many more people you're going to hire this year, but are we, and realizing it's been a fast, steep ramp up on that, I get that. What are we approaching basically full capacity of employees that we're going to be hiring so we can start continuing to do what you're talking about, doing the training and kind of get everybody, I guess, get the whole team together, and are we ready to go? So are we getting close to that in year 2?
Commissioner, on this slide here, we talked about hiring up of staff in our community-based partner organization. So moving from 38 to 72 additional for a total of 110. So that represents our community-based partners staff expansion, if you will. And they will begin hiring those staff as soon as we execute those contracts and get them funded to do so. To complete that thought, I think they are nearing the full capacity of the 38 staff that we have contracted with them to hire this year. If your question is about our own department staffing, the team has been growing quickly over the course of the year. We are currently hiring for a couple of positions, and I think there are several positions that are considered in the budget, but I defer to Josh to describe any of our departmental position work.
And before Mr. Kreitz actually answers that question, Commissioner Willie, staffing needs for Washington County to support the SHS program and these goals will be included in the proposed budget, and we can dive deeper at that time. We're in the process of budget review, so I would kind of ask we don't go deep into that rabbit hole at this time.
Yeah, that's a good point, Tanya. So thank you for that. And I'll look forward to that conversation when it's a little bit more appropriate and we're talking about the budget. So yeah, I was just wondering if the housing workers at 110, is that about where we're going to be at the end of the day? That I didn't mean to get into the budget side of things. I was just strictly talking about how much further are we going to continue to ramp up? But I can wait for that kind of conversation at the appropriate time. So thank you for that. And and then the last thing is, as I think you all know, I have had the opportunity to tour the Bybee Lakes facility. It obviously is housing a significant number of people and doing some great things, but it is privately ran. Is when we talk about diverse shelter options, would we consider possibly talking about working with an organization that's more on the private side of things and participating with them, I guess, to help us reach our numbers?
Thank you, Commissioner. Excellent question. Yes, there's no consideration for nonprofit status versus for-profit status of our community-based providers. We currently have a pool, actually a tri-county curated pool of qualified providers for supportive housing services of more than 100 organizations now. That list includes both private and nonprofit partners that can act in service provision. And so really the consideration for selecting partners is more on experience, demonstrated record, and their willingness to do the work according to the contractual guidelines we offer them.
Okay, that would be great. Thank you very much. I appreciate your hanging with me on that. Didn't mean to take so much time. Thank you, Chair, for giving me that additional time, and I'm thumbs up on both of the questions.
Thank you, Vice Chair Willie. I'm sorry I missed a portion of that as the internet kicked me off because I usually learn from your questions and the exchange. So thank you. Commissioner Rogers, you're up next.
I just have two questions, and I'm thumbs up as well. But the questions are, first, you mentioned that you were excited that the number of people who responded to your, I'll call it a survey, but I think it was a little different than that, was very high, but the number seemed very low to me. I mean, there wasn't that many of them. So help me to understand why that exceeded expectations with such low numbers. I don't know who that's to, I guess.
I'll jump in here and I'll invite Janine to piggyback if there's anything I leave off. Thank you, Commissioner. It's an excellent question. I think we set a goal of being able to speak directly with impacted persons of, I think it was 25 or 30 individuals, and we were able to have 38 full conversations. These were pretty lengthy one-on-one conversations. It was a survey that of questions, but it was conducted in a one-on-one setting so a lengthy kind of interview conversation. So it's quite a bit of staff work to pull together those one-on-one conversations with our stakeholders and impacted individuals, which was different than the sort of the public survey link, which allowed individuals to just answer the questions individually online. So that's why we saw such a difference in the number of participants in the various surveys, because the quality of the survey was kind of a different structure and experience. I hope that helps answer your question.
Yeah, it does. It just, yeah, for somebody who is not understanding exactly how that worked, they would draw the impression I did that, boy, that's not much of a survey, but I get it. You went more in depth, and you might figure how you scope that explanation so that any reader might say, okay, I get it. So I think somebody else going to say something?
It's Janine, it's me.
Okay.
So in addition to that, we also looked at the capacity of the shelters, which is why the stakeholders number looks the way that it does. And also when it comes down to the impacted people who are experiencing homelessness, we took a look at the population within both of the shelters that we went to, which was the Cloverleaf and Beaverton shelters. And we set goals based off of the number of people that are actually in our shelter programs.
Great, thank you. I understand. I just still think it might be enhanced, your report, by kind of describing why those two are different. The next question is much more complicated, and I would say it goes to Tom Carr, and it needs to be at some point, I guess, for the record. You spent a lot of time talking about equity. This board said that's one of our key mark issues, and I don't take exception to how you portrayed it. But there's been a lot of court cases recently about quotas, and it seemed to imply that there were going to be quotas in what was presented. It said, well, we're going to specifically identify certain impacted groups, and we're going to target them and give them preference. And so, Tom, based upon U.S. court cases going now and everything from education to various programs, can we have, I call it quotas, you may not want to use that word, but can we do that?
Yeah, I wouldn't really call it quotas. Incentives and targeting, especially historically challenged communities, have generally been upheld. I'm not really up on the law as much as I'd like to be to answer your question completely, and I'd like to do a little bit more research. But generally, the way this program is structured complies with the law, because we're not talking about quotas. You're not saying you have to have X number of people in a category. What we're saying is providing incentives to address historical inequities, and I think that's generally supportable. I see Josh nodding.
I know in the educational area, there's been a lot of cases recently in regard to certain universities who gave preferences, as you say, for certain reasons, and they've been found not to be lawful. And so I always get concerned when we start saying that's what we're going to do. I don't disagree with outcomes sometimes, or what we're trying to accomplish. I disagree with statements that seem to imply that we're using some preferential treatment, which is not equity. I mean, that's different. And so I just, the wording there might need to be polished a bit, but I understand your position, Tom. And I wanted it, so I understood it if we ever get that challenge on this particular issue. it's on the record.
Well,
So.
And Commissioner Rogers, I'm happy to look at it a little bit more closely and give you a more formal opinion. I think that really the outcomes are what's important. We have so many people that need the help. I think that these folks are doing a great job at across the board at helping everybody they can. And so, but I'll make sure that we're within the letter of the law.
Thank you, Tom. Again, I take no exception to what we're doing. That's why I'm in favor of the report and what we're trying to achieve. I just want to make certain that the perception is not different than what we need to do.
I appreciate your concern about making sure we stay on the right side of the law.
Yeah. Okay. Thank you. That's all I have. I'm in favor.
Thank you, commissioners. I appreciate all of that and having the benefit of your questions. So I started with a couple of questions, but I think this discussion has caused me to have a few more for clarification to make sure that I understand what is being proposed and what you're asking each of us to approve. So I'm going to start with slide number 6, I believe it is, on the community guidelines for the shelter program. Yes, thank you. So I had a meeting with some constituents late last week who expressed concerns about the methodologies used to perform different surveys. What I got out of your presentation, for me, clarified that what I was hearing from them was more about, sort of check the box surveys, which from your presentations and answers to district commissioner questions, sounds like that public facing one was more of that style, and I may be summarizing its style incorrectly. But the question that I have is, in addition to your surveying through in-depth conversation of folks actually impacted by homelessness as they've been taking advantage of services or utilizing services at both the Cloverleaf and the Beaverton shelters, did you also do any in-person surveys with folks that are in some of our homeless encampments?
So although we weren't able to conduct surveys in homeless encampments, we did have individuals who aren't exactly within our shelter programs, but let's say they may go to our the shelter programs to get a meal. And one of the things that we also did was we asked individuals who are participating in shelters, if you have anyone else that you know who's also impacted by homelessness, who would like to fill out a survey, please have them come. And so we also had individuals who aren't being housed in our shelter programs, but attended our engagement series. They also helped to fill out surveys as well. So we had random people impacted by homelessness come up and say, okay, well, we do want to fill out this survey. Thank you so much for actually listening to everything that, there is that we want to say. And they were really appreciative for that, same as that was a concern that was raised within our community engagement events. So we started kind of filling the chat with our surveys and pitching a survey. So we did reach far and wide. It wasn't just individuals who were at the Cloverleaf or Beaverton shelters. We also had individuals who are currently sleeping on the street.
Thank you, Janine. I appreciate that.
Welcome.
My next question on slide 9, but really goes to the document on in the packet. It's under the next steps category. This second to the last page at the bottom, second paragraph, where it talks about staff will convene a team to consider potential sites as they are identified using the community guidelines. to assess fit, priorities, and next steps. Staff will bring forward any potential sites for the Board of Commissioners consideration before moving forward, blah, 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 blah. So I think the four of you here today have done a good job in my mind of helping me understand, through the course of the program and today's presentation, that there's the physical siting, the locations, but then there's providing the services. And much of what the county does is providing the financing and the framework for providing the services and achieving the goals of the measure. Did I get that right, Josh and Jess? That latter part? So I'm describing it A-okay? Okay, so my question is this. I'm struggling a little bit. I can imagine that if the county is going to purchase a property, then of course we need to be engaged. But as long as you're engaged with partners using these community guidelines, why do we have, I'm trying to understand, how is it that we would have any authority, and Mr. Carr, maybe I'm reading too much into this, authority over their locational siting? That whole part just isn't clear to me. And maybe I missed it earlier in the document that explains why the commission needs to have a role in that physical siting. Could you help me better understand that, please?
Thank you, Chair. Excellent question. And yes, if the county is considering the acquisition of a property, that very much changes the nature of the process and discussion that our leadership would engage the board in with any such site. And so far, as exampled with the 3 sites that are under consideration in Beaverton, Hillsborough, and Tigard, we aren't the owner. However, in all of those cases, we've been asked, it's more about early coordination among staff, because in order for these acquisitions to move forward, the other jurisdictions need to understand the partnership, the criteria, expectations for operations, and the future work with our side of the equation, the service provision of those shelters. And so I think in such cases, it would be more about keeping the board informed of such sites that are under development, but not needing formal approval, because you're right, those would not be buildings or properties that are our jurisdictional authority to determine. I hope that's a helpful answer, but like anyone wants to back clean up, please jump in.
I think what it was I read too much into the word "and" being used, as opposed to the word "to" being used, right? Before moving forward, to maintain full communication with advisory bodies and key stakeholders, right? That makes the goal clear to me, and I really appreciate your setting me straight. Okay. And in response to some commissioner questions, if we could go to slide 15, or I need to identify the slide number. I remember when Ms. Smith was summarizing, or no, I'm wrong about who was doing the summarizing. Someone during the presentation talked about how we had a successful year for our severe weather shelters are emergency shelters. That's the right word I should use. And how moving forward, it may be more difficult ahead to hit that same level. So when I got to slide 15 with the SHS table, right? So here's where I may have confused two topics. So when I got to this slide, I was like, okay, let's see. We went from having year-round shelters just for families, women and children, to now this year having year-round shelters for individuals, men, women, and couples. So I feel good about that. And I don't know if I just misunderstood that our year-round shelter goal is going to be hard to achieve, or if it's that emergency and severe weather shelter. So I got something wrong there. Can you set me straight? And if we need to take it offline to save time, I'm happy to do that.
Actually, Chair, you're tracking very closely. I appreciate that. It is confusing. So basically, winter shelter capacity is what we have in lieu of having adequate year-round shelter capacity. And so we locate the operations of winter shelters as best as we can, with as much capacity as we can locate, because we know how critical it is to have emergency shelter options during those at least 4 months of the year. And right now we're extending them as long as we can have access to the buildings to extend them in. But the goal is ultimately to stand up a year-round shelter capacity. So we're not opening and closing shelters. It's going to take us time to get there. Many of those shelters that have recently been potentially identified are going to take years for our partners to build out. So we're going to be left to lean on winter shelter capacity. And every winter we have to site those. We have to identify where we can host them. We're using the Cloverleaf right now. It's been a great resource. We don't know if that will be a resource we can revisit next year yet. So that's the kind of scrambling of the shelter beds that we do every year. And this goal represents our commitment to stand up that permanent, year-round shelter capacity. And in the meantime, we'll do as much as we can by way of winter shelter in its place.
So for this table, the housing workers, we have 38 on board now. For year 2, this is conveying you want a total of 72, right? Not adding 72 more.
I'm sorry, the way we structured this table was to show you the goals we set in year 1 with the goals we're setting in year 2. And then when you add up that capacity as is the total line. So it would be adding 72 workers through our contracts with service providers in year 2, which would give us a total funded capacity of 110 workers in the system after year 2.
So the reason I use that as an example is to make sure on the year-round shelter capacity, we achieved 102 year-round. We're adding 72 more in year 2. We're not going backwards, but rather we're adding 72 more. Okay.
That's great.
Okay. But for the emergency year-round, emergency winter shelters, we hit a certain capacity, but that's an annual effort. Got it. Thank you. Phew. I'm in the home stretch, folks, and these are just clarifying questions. So hopefully it'll be quick. Okay. Well, number 4. So yes, I think it was on the equity lens. The measure outlined equity requirements, correct? So it isn't just based on our own equity resolution that we passed 2 years ago.
Well, that's very correct. There's a lot of equity requirements in the measure.
Okay. And then 5th question, on the, and on the IGAs, you were answering a question for Commissioner Willie on the revenues. And I have forwarded one, maybe two of the finance memos that the oversight committee has gotten from Metro Finance on the incoming revenue and forecasts. I believe all that information is publicly available and online. So if commissioners want it. But commissioners, this is my question to you is, do you want me to make sure that as Metro staff provides that to the oversight committee, I can just forward that and highlight it to you via your inbox? Is that something that a majority of you would like? Sorry, I'm having trouble seeing. I see 2 thumbs, 3 thumbs. Okay, okay. And then lastly, where Mr. Carr was talking about the incentives to Commissioner Rogers' question about quotas. Staff, and this includes Mr. Carr, it's my understanding that the measure outlined goals to be achieved, that there's a lot of flexibility in how we go about that. And maybe that's the word where the word incentives comes in. But more specifically, given that the measure that the voters approved had legal goals, we're being required to be accountable to progress towards those goals. Mr. Carr, are you comfortable that this approach is within the law and that we, as long as we follow the staff recommendations to us, that you and your team have approved, that we're within appropriate bounds? Or am I missing some nuance?
No, I don't think you're missing a nuance, Chair Harrington. And to simple answer, yes, I do think we're within the legal bounds. I think Commissioner Rogers' question doesn't deal so much with the measure or state law. It's a question of federal law and equal protection. And
Right.
so, and I offered to do a little bit more research to make sure, but I'm sure that research has already been done and the work is compliant, is in compliance. But as I said, I always appreciate Commissioner Rogers making sure that we are doing the right thing.
Okie dokie. All right, I'm tracking. So yes, I am thumbs up on this and appreciate how our guidelines allow for us to continue partnering with the community-based organizations, whether they're nonprofit or for-profit, as well as with our jurisdictions. And over the course of time, that the team has many tools in the toolbox to draw from, so that as a private entity or as a city jurisdiction wants to sponsor a site for a safe sleep village, or if they want to sponsor a site for RVs, RV camping and whatnot, that our team is able to have that constructive engagement with them on that. Oh, darn. I forgot to ask one of my questions. It was on page 8, because that closing comment reminded me of it. Under community guidelines for shelter programs, my question here was, I really appreciated how our staff helped our community respond to COVID and hosted a respite center at the former motel that the Port of Portland owned over by the airport, and that per the port's plans that needed to close, but staff was able to seek funding through Project Turnkey to acquire another hotel to sponsor the respite shelter for COVID, but also to help have a more rapid response for getting homeless persons or people becoming homeless some bridge shelter. And therefore we had both the Bridge Shelter Aloha program, which is now transitioning to permanent supportive housing, permanent affordable housing, as well as the Bridge Shelter Hillsborough, which is transitioning as we committed to towards affordable housing. Is it wrong for me to, or how would you put it? Is it wrong for me to think that that Bridge Shelter program was one of the tools for more rapid, temporal solutions, but also that they helped serve as pilots for developing these program guidelines?
I think that's, sorry, I'll invite Josh to help answer this question too. I think that's a fair description. The goal of Project Turnkey, and in many ways our acquisition through the Affordable Housing Bond of the Aloha Inn, which wasn't a Project Turnkey, but is sort of behaving similar to, is to quickly create capacity while simultaneously planning for the long-term use of a building. And that's similar to how Central Cultural, our partners who have purchased the Forest Grove Inn and are operating Casa Amparo as well. So it's an immediate response with a longer term planning effort, if that is an answer to your question.
And yeah, and I would say like, this is also coming out of, I remember Chair Harrington, I think it was you, myself, and Marnie, we got invited to something about hotel conversions. I don't know if you remember this. This was maybe like 15, 18 months ago, but we're all on a phone call together. I think it was a national call with CSH. And this was a national best practice, right? To quickly, especially when hotels were in a downturn with the economy, to purchase, find some quick bridge housing, get people inside, respond to COVID-19, and then think through what is that strategy. And I heard the board talking about national conferences, and I'll be going to one talking about hotel conversions and presenting on this in a couple of weeks. And so I think a lot of communities, Austin, Texas in particular, who I've been talking with, are looking at what are those next steps and how do you go through those conversions. But it's been a really rapid response way for us as a community to respond to homelessness and COVID-19.
Well, I want to ensure that you have the opportunity to hear and feel my appreciation for your doing that immediate response to community needs and helping ensure that we are true to our word for the longer term use, because with both the former Bridge Shelter Aloha and the Bridge Shelter Hillsborough, those are transitioning. And along the way, you've done a great job of maximizing the learning opportunities. So thank you very much. So I'll finally close my comments. Thank you to staff. I am thumbs up on both of these elements that you brought forward for our Q&A today. And I look forward to the appropriate adoption that you need from us. And joining my 4 colleagues.